Hello, today I'm talking to Dr. Haroon Gajraj about living with varicose veins. Dr. Gajraj is one of the country's leading vein specialists and he runs the Melbury Clinic in Dorset. Dr. Gajraj, thank you for talking to me today. Today I'd like to start by asking you, are varicose veins dangerous?
That's a good question. I think a lot of people are worried about varicose veins, but the reality is that the majority of people with even quite severe varicose veins don't come to any serious harm. However, they do cause potentially serious problems. They're a risk factor for deep vein thrombosis, they cause varicose eczema and leg ulceration. And they cause a lot of misery to people. They can be uncomfortable, painful, they can cause swelling, and to a number of people they're very unsightly and they cause a lot of distress. But for the majority, they are not dangerous.
Why do varicose veins hurt, ache or throb or itch?
That's a good question. The symptoms of varicose veins are often said to be non-specific. So what that means is that there are many people who don't have vein problems who get similar sorts of symptoms. So just because your veins, or just because your legs ache and swell and throb doesn't necessarily mean you have a vein problem, but it's highly suggestive. The mechanism by which they ache, throb and itch is probably the reflux, that is the abnormal downflow of blood, is causing an inflammation of the veins repeatedly, and that releases chemicals such as histamine, for example, which can cause itch. It also causes a problem with the actual return of blood from the veins, and the mechanism by which blood leaves the leg is not as efficient if you have varicose veins, and I think that partly explains the swelling and the throbbing and the itch. Interestingly, when you're not sure whether your symptoms are due to a vein problem, it's often helpful to have what's called a therapeutic trial of medical stockings. So wearing good quality medical grade compression hosiery, if that helps your symptoms, then it's very likely they're due to your vein problem. On the converse, or the flip side, if wearing those stockings doesn't help at all with your symptoms, then it's unlikely that treatment is going to help, and it's unlikely that your symptoms are due to vein problems.
Can varicose veins burst?
I think that's one of the real worries that a lot of people have. Are my varicose veins likely to burst, and am I likely to bleed catastrophically? In reality, bleeding from varicose veins is actually very uncommon. It's very unusual to cause any injury or trauma to your veins sufficient to cause them to bleed. But it does happen, and very occasionally the bleeding can be very severe and can be an emergency requiring hospital admission. In my experience, bleeding is much more common from little spider veins and blue venules under the skin, the ones that are actually very superficial and very vulnerable. And I do see quite severe bleeding more commonly from those sorts of veins rather than true varicose veins.
What about wearing compression stockings? Can they stop varicose veins getting worse?
Well, I don't know about this. I think this is a controversial one. There's no doubt that compression stockings will aid the symptoms of varicose veins. So if your leg aches, swells, throbs, your legs will feel better whilst you're wearing the compression stockings. And there's no doubt that whilst you're wearing the compression stockings, the reflux will be controlled and it won't be quite so severe. So wearing compression stockings, I think, is a good thing, but it's not going to cure the underlying problem. Whether it really prevents varicose veins getting worse, I don't think we know. Intuitively, you might expect that if you're supporting your veins with a good stocking, they're less likely to stretch further and get worse. But we don't have that information. I can't say to you there is documented evidence in the literature to support that. My own personal opinion is that it probably does. I wear compression stockings to reduce the risks of developing vein problems, and it's the advice that I give to patients to consider. I think people should have the option of wearing it if they wish to.
Is it true that cold showers, saunas, yoga, massage or leeches can help with varicose veins?
I don't think any of those will help with varicose veins. But having said that, there's no doubt that the symptoms of varicose veins are worse in hot weather. And certainly a lot of people will complain that in the summer or when they go on holiday, their legs hurt and swell more. There's no doubt also that a cold shower or rinsing your leg with cold water temporarily helps your legs feel better. So I think that certainly ambient temperature or using cold water helps. But as for leeches, yoga, saunas and massage, I don't think they're going to help. They may help your leg feel better. Elevating your leg with certain yoga positions may offer you symptom relief. Massage may help your leg feel better, but I don't think it's going to actually help with the underlying problem. Cold showers do help with the symptoms of varicose veins. And equally, a hot shower or a hot bath will cause your veins to fill more. They certainly look worse after a hot bath or a hot shower, and they often feel worse after a hot bath or shower. I think cold showers will certainly help your legs feel better, and cold naturally tends to make the veins constrict or close. So it does help, but it's symptom relief. It's not really addressing the underlying problem.
Are there any herbal remedies for varicose veins?
Do you know, I don't think there are. It's a mechanical problem. It's a problem with the valves, and you've got a mechanical problem. You've got downflow of blood in the wrong direction. There may be remedies which offer symptom relief, and they may help your leg feel better, but they're not going to make a difference to the actual underlying problem.
Does smoking or drinking alcohol or caffeine make varicose veins worse?
There's no evidence that any of those makes varicose veins worse. They're all certainly, some of them are unhealthy things to do, smoking, and the advice would be to not smoke for general health benefits. You might think that smoking also might damage the collagen in the veins, so I'm sure it has a bad effect on the collagen in the veins, so it's probably best to avoid it if you've got a vein condition. But there's no evidence that caffeine, smoking or alcohol damages your veins or causes vein problems. Alcohol? Well, if you were to drink a lot of alcohol on a long-haul flight and become dehydrated, then that could well be a risk factor for deep vein thrombosis, but I don't think it's a risk factor for varicose veins.
You've mentioned reflux a few times. What exactly is that?
Well, superficial vein reflux is a downflow of blood in the wrong direction in the veins just underneath the skin. Whenever anything travels in the wrong direction in the body, we use the term reflux. So for example, if you have acid indigestion reflux, acid is coming up in the wrong direction when it should be going down to digest your food. Well, in the veins of the leg, the blood should be travelling upwards from the foot back upwards towards the heart. And if blood is travelling down in the wrong direction, we call it reflux, and if it's in the superficial veins, we call it superficial vein reflux. And that's caused by a problem with the valves. We've got delicate folds in the lining of the vein that shut, preventing gravity pulling the blood down in the wrong direction and directing the blood upwards. Now, if those one-way valves are not meeting properly, you have this condition called superficial vein reflux. So if you have this, what would happen when you get out of bed first thing in the morning is that gravity would pull the blood down from the top of your thigh usually, where the faulty valves normally are or usually are, down your leg, and they would fill the lumpy varicose veins that you can see. They would also fill the spidery veins that you can see, and they would also, that reflux would also cause varicose eczema, phlebitis and leg ulcers, as well as putting you at an increased risk of deep vein thrombosis.
And just lastly, do varicose veins ever go away by themselves, or do they only ever get worse?
I have seen varicose veins cure themselves after phlebitis. Phlebitis is a serious condition in which there's an inflammation in the veins, and occasionally, if you wear a compression stocking promptly and for long enough, the phlebitis can actually cure the varicose veins, by which I mean the varicose veins will shrink and shrivel and disperse. And I've seen several people who, when treated appropriately, their varicose veins go away. However, apart from that, I've never seen varicose veins just disappear. And because it's a mechanical problem, it does tend to get worse with time. Another special circumstance is during pregnancy. I've seen a number of people who've developed varicose veins during pregnancy, and then when they've had their baby, the varicose veins shrink and disappear, in inverted commas. However, before they became pregnant, they had reflux. During pregnancy, they developed varicose veins because pregnancy made the reflux worse. And then after pregnancy, the varicose veins disappeared, but the reflux persisted. So although your varicose veins may disappear when you've had your baby, it's still worth having your duplex ultrasound scan to check for reflux, because if you do, and I'm sure you will have if you've developed varicose veins during pregnancy, you should have those treated so that you won't develop problems in a subsequent pregnancy and you won't develop problems as time goes by.